Just a quick update on COVID cases for March the 2nd. Over the last 14 days in Forsyth County, our cases have decreased by 48%, and our deaths have had a slight uptick of 13%. In the last 14 days, we've had 6 COVID deaths, and we have 12 Forsyth County residents who are hospitalized with COVID-19. Looking at our lab confirmed COVID cases, the week of February 19th through the 25th, we had 247 cases. These are only records of lab confirmed cases. These don't include at-home results. And you can see where we've had a gradual overall, the trend is declining over the last 1 to 2 months. Our community level, as of last Thursday, went down to low per the CDC. So masks are basically a personal preference based on your personal risk level. We still recommended that people with symptoms or a positive test or exposure to someone with COVID-19 wear a mask. We're looking into the future for COVID-19. We know the federal emergency is ending May 11th. Our state vendor support will be going away March 30th. At-home test kits are available at all 10 library branches, health department, and government center. We have now enough on hand to last at least 12 months. We also are working with a vendor across the state to get a kiosk, which would be kind of like a red box where a person could come. The kiosk will be outdoors, accessible 24/7, where persons can get free test kits that way. We're looking to get that installed this month. And then we're looking forward into June and beyond as vaccine will be commercialized, and there will be a fee that health departments and doctors' offices and other locations will have to pay for the vaccine, and how we'll handle that in coming soon. Well, I think the simplest way to say it is, the vaccine for the last now 2 years, we've been able to get that vaccine at no charge. And we have passed it on to residents at no charge as well. So we have, and then also we've even gotten the supplies, the syringes and other ancillary supplies at no charge. So going forward, there will be a cost that we will have to put up. We will have to pay for the vaccine and any of the supplies. So we're looking at, as we plan now for next year's budget, county government, our new budget year will be July 1, 2023 is when our new budget starts. So as we're planning for that new budget year, we're looking at how we can provide the vaccine and just how that will work for the community, because we want to make the vaccine as readily accessible, but the vaccine is going to be at least $100 to $120 per dose is what we've been told. Well, COVID is still out there. We are seeing 247 cases, and that's just lab confirmed cases. We know there's more cases. There's probably 3 to 4 times that many cases out there in the community, and people either have very mild symptoms or they did an at-home test. So we know that COVID is still out there, and we know that the way this circulates is variants seem to come and go, and other variants come on the scene and they quickly take over. So that's happened throughout the pandemic, that different variants have taken over. I think what you're seeing too across North Carolina, and I think most of America, is that pretty much 95% of individuals have had COVID. Maybe you didn't know that you've had COVID, but that's what the epidemiologists and the scientists say. So we have a lot of built-up immunity, and the vaccines are working. As you saw the numbers, less and less people are hospitalized. So the COVID vaccine won't necessarily keep you from getting COVID, but it'll keep you from getting severe COVID, which is hospitalization and death.